Now we are at the last leg of our lecture, and this will be all about inhaler devices. So here I'm going to show you the different inhaler devices available in the market and how to use them properly. It is very important that we are able to know how to use each and every inhaler device, because it is very important in the control of asthma on the proper use of inhalers. Because if the patient is unable to use the inhaler properly, no matter how good the inhaler is in the first place, it will never work. So let's proceed. So we have a lot of inhaler devices available in the market. We have the MDIs, we have dry powder inhalers, and then we also have a soft mist inhaler. So these are available in our country, except for some of them. What we do have in our country and are easily available or are easily purchased in the pharmacy, and these would include your Spiriva hand inhaler, your Ellipta, your on-breast breast breeze inhaler, your Ultibro breeze inhaler, Symbicort turbo inhaler, Seretide AccuHaler, or in our country it is marketed as Seretide Discus. We also have Symbicort Rapid Inhaler, and finally a Seretide MDI. So we now first go to the MDI. MDI stands for meter dose inhaler. So it is a handheld aerosol device that uses a propellant to deliver the medication or therapeutic agent. It has some disadvantages and advantages. Advantages of the MDI would include portability. There is multi-dose delivery capability, and it has a lower risk for bacterial contamination. However, the use of MDI will also have its own disadvantages, and this would include the need for correct actuation inhalation coordination. This is actually a device that would require experience and repeated use so that it would be properly used, and there's a little bit of difficulty compared to the other types of inhaler. And it has a tendency to have an oropharyngeal drug deposition because of how fast the delivery of the medication is, and there's a possible flammability because of the hydrofluoroalkane propellants that's used in the manufacture of MDIs. Next, we have dry powder inhalers. Dry powder inhalers are breath-actuated devices that deliver the drug in the form of particles contained in a capsule or blister that is punctuated prior to use. This type of inhaler requires adequate inspiratory flow rate for drug delivery, as it does not include a propellant, versus the MDI. So it has to be, this actually is dependent to the patient himself or herself. Now, because of the requirement wherein the patient has to inhale properly, these devices are not recommended as initial use among patients with acute exacerbations of asthma, especially if the asthma exacerbation is considered as moderate or severe. So what are the advantages of using these dry powder inhalers? They're actually breath actuated, so it's dependent on the patient. Spacer is not necessary. Priming is not necessary as compared to your MDI. And there's no need to hold breath after inhalation for prolonged periods of time. It's actually also portable. However, the problem with the TPIs is that it really requires adequate inspiratory flow for the medication to be delivered into the lungs, and it can actually result in high pharyngeal deposition, and the humidity can potentially cause the powder to clump and reduce the dispersal of the medication. And then we have the soft mist inhaler. So this inhaler actually has only one, it's still patented under one company, and it's the Boehringer Ingelheim. The very good advantage of the soft mist inhaler is that it doesn't require a higher expiratory flow rate compared to the dry powder inhaler. So the patient would just, it all requires the patient's inhalation lab. So no need for them to inhale deeply. So regular inhalation or regular breathing. Then we have the old reliable nebulizers. Uh, there's not much technique or necessary in using this type of inhaler device. Just put the medication inside the chamber, turn it on, and then maybe just breathe normally. Inhale through the nose, exhale through the mouth. You have to do that slowly and properly, or else it would, if we open our mouths for during nebulization, it can actually cause abdominal distension.
Remove the cap. Shake the inhaler. Breathe out. Seal your lips around the mouthpiece and start to breathe in slowly. Press your inhaler once and keep breathing in slow and deep. Remove the mouthpiece and hold your breath for 5 to 10 seconds. Breathe out. If another puff is required, wait at least 30 to 60 seconds and repeat all these steps. Replace the cap and then rinse your mouth with water. It is recommended that a spacer device be used with this type of inhaler to help improve the delivery of medication to the lungs. These are available at your local pharmacy. Slide open the discus. Slide the lever over until you hear a click. Breathe out, away from the discus. Seal your lips around the mouthpiece and breathe in quickly and deeply. Remove the discus from your mouth and hold your breath for 5 to 10 seconds. Breathe out. Close the discus and repeat these steps if required. Then rinse your mouth with water. Hold the inhaler upright and twist the cap off. Turn the base in one direction and back until you hear a click. Breathe out, away from the turbuhaler. Seal your lips around the mouthpiece and breathe in quickly and deeply. Hold your breath for 5 to 10 seconds. Then breathe out. If you need a second puff, repeat these steps. When you're finished, place the cap on, twist to close, and then rinse your mouth. On first use, you will have to open a foil tray and remove the inhaler. Discard the packaging and tray. On the inhaler, write the date the package was opened, as well as the discard date for 6 weeks from opening. Slide open the cover. You should hear a click. Breathe out fully away from the mouthpiece. Seal your lips around the mouthpiece and take in a long, steady, deep breath, ensuring you do not block the vent with your fingers. Remove the inhaler from your mouth and hold your breath for 5 to 10 seconds. Breathe out. Close the cover and rinse your mouth. The Respimat device comes in 2 pieces, the inhaler and a medication cartridge. Before it is used the first time, it will need to be assembled and primed. With the cap closed, press the safety catch to remove the clear base of the inhaler. Push the narrow end of the cartridge into the inhaler as far as it will go. Place the inhaler upright on a firm surface and push firmly down on the inhaler to ensure the cartridge has gone all the way in. Put the clear base back into place. To prime the inhaler for use, hold the inhaler upright with the cap closed. Turn the base in the direction of the arrows until it clicks. Flip the cap open. Point the inhaler down and press the dose release button. Close the cap. Repeat this 3 more times. Now to use the inhaler, follow these steps. Hold the inhaler upright with the cap closed. Turn the clear base a half turn in the direction of the arrows until you hear a click. Flip the cap open. Breathe out fully and slowly. Close your lips around the mouthpiece without covering the air vents. Point the inhaler towards the back of the throat. While taking in a slow, deep breath, press the dose release button and continue to breathe in slowly. Remove the inhaler from your mouth and hold your breath for 5 to 10 seconds. Breathe out. Close the cap, and if another dose is required, repeat these steps.